Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series, which can be heard on VHHA.com, Apple Podcasts, Spotify, and wherever else you get your podcasts. We're a member of the Virginia Audio Collective and the Family Podcast Network, on the radio each Saturday at noon and Sunday at 10 a.m. on 100.5 FM, 92.7 FM, 107.7 FM, and 820 a.m. across Central Virginia, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send any questions, comments, or feedback to pcfpodcast@vhha.com. That's pcfpodcast@vhha.com. I'm Will Selden with the VHHA team, and today we're excited to be joined by Sharon Blackwell, a nurse at Chesapeake Regional Healthcare, for a conversation about hospital efforts to improve community health and reduce disparities through Wellness Wednesdays program. So with that, welcome to the program, Sharon. Thanks for being with us.
Thank you so much for having me.
Well, thanks so much for being with us, Sharon. I want to start on a happy note. You were just named a 2022 Healthcare Hero by Hampton Roads Inside Business Journal for your work as a nurse and case manager in the hospital emergency department, where you focus on getting folks the necessary post-discharge care and services so they can recover and not end up back in the hospital. So we first just want to join everyone else, a long list of folks that are wishing you congratulations and say thanks for all your hard work.
Thank you so much. I appreciate that.
So I want to stay on the subject of your work for a little bit. We know that proper discharge planning, instructions, and support are critical elements of patient recovery. Getting those things right can make a difference in healing in post-discharge setting versus an avoidable emergency department visit or hospital readmission that can be both costly and absorb finite resources for everybody. So tell us, if you would, about Chesapeake Regional's focus on limiting unnecessary hospital encounters, as well as your collaborative efforts with other hospitals, and maybe the results of that work as well.
My position here at Chesapeake Regional as a case manager is that I focus on multi-visit patients, so patients who come to the emergency room at least 5 times in a 12-month period, and also people that have been admitted to the hospital multiple times. And I, through assessments and conversations and building a relationship with the patient, I try to find barriers to good care outside the hospital that could be causing them to come back unnecessarily. What we find is a lot of the reasons that they continue to come back is not necessarily a physical or medical, but a social reason, such as no health insurance, no primary care provider, poor transportation, poor support system, those kind of disparities.
Do you wish you could focus on practicing medicine without all the distractions? Coveris is here to help. As a leader in medical professional liability insurance with more than 45 years' experience, Coveris provides insurance protection with data-driven predictive modeling to help you mitigate the risk of claims. By combining insurance protection with risk analytics services, you can reduce distractions and focus on improving clinical, operational, and financial outcomes. Coveris is reinventing what you should expect from your medical professional liability provider. Find out all Coveris can offer you at coveris.com. That's COVERYS.com. Insurance products issued by Medical Professional Mutual Insurance Company and its insurance subsidiaries, Boston, Massachusetts.
In the intro, we mentioned Wellness Wednesdays, which are free public events supported by Chesapeake Regional that are held quarterly at different locations around the city. And the way I understand it is the goal of those events is to break down barriers to, like you mentioned, accessing better health by partnering with dozens of community organizations to offer things like health screenings and access to support groups, legal aid, housing, employment. The list goes on and on. You recently had a wellness event at the beginning of June, and I believe another one scheduled for early August. So could you tell us a little bit more about that program and how it's been received in the community?
Sure. It's been very well received. We've been overwhelmed with organizations and groups who want to participate with us to provide services and resources to our at-risk communities here in Chesapeake. What we found was when we broke down our multi-visit users, we found that a lot of those people reside in areas of the city that have less access to resources and care, poor transportation, lower median income, those types of things. So we wanted to bring the resources and the information and the education to them, to their doorstep. So instead of them having to travel across the city to get to some office, we take it to them. So it's set up kind of like a farmer's market or a fair. Everybody has a table and people come for free and they can visit as many tables as they like. They can get resources on anything from baby care all the way to senior services, mental health resources, housing, jobs, domestic violence, anything that you can think of. We have somebody there to provide resources or programs that can help.
That's so great. Thanks for sharing that. And we should note that anyone listening who wants to learn more can do so online by visiting ChesapeakeRegional.com/Wellness Wednesdays. Again, that's ChesapeakeRegional.com/Wellness Wednesdays. So going back really briefly to your Healthcare Hero Award, one of the things I noticed in your profile was you have a super clear and obvious passion for your work and a really positive spirit. In the article that I read, you cite the value you see in, quote, lightening someone's load, which I love, and the importance of finding career happiness with an organization that values employee input and feedback. So I'd like to explore that notion through the lens of the pandemic, which, as everybody knows, has been trying for patients and providers alike and has caused a lot of professional burnout for a lot of folks. So, with all that context in mind, what wisdom can you share with other healthcare professionals about the strategies you've found effective for staying positive, even when you're facing really difficult professional challenges?
I think what I try to do is just develop a relationship. People are much more likely to trust you and open up to you and share their difficulties with you if they know that you're not just there to check some boxes. You're actually there to develop a relationship with them and to try your best to help them overcome whatever it is that they might be struggling with. One quick example is we teamed up with the city during the pandemic to help the homeless population here in Chesapeake. And one of the things that I did was to try to help a couple of the people apply for jobs. And what I found very quickly is that it is so much more difficult for someone in that situation to find a job, apply for a job, go for your testing, close to where to the interview. All that stuff is a hurdle that a lot of us don't have to worry about. So it takes extra time, it takes extra effort to help some of these people with the struggles that they're dealing with. But you can be successful if you want to be successful. If you want to help somebody, you'll take an extra few minutes, you'll ask a couple extra questions, and you'll go a few steps further to help them.
Yeah, I'm totally with you. I think in those situations, like you mentioned, going the extra mile and asking that extra question and trying to walk in someone else's shoes, so to speak, can be so important. And I'm just glad to hear that folks like you are doing that important work, so thank you. To close, it's a tradition on this podcast to ask our guests a few personal questions just to give our listening audience a sense of who you are beyond the work that you do. And so to keep things fun and interesting, we're going to have you choose from a list of 10 mystery questions. So if you would, go ahead and pick two numbers between 1 and 10, and I'll ask you those corresponding questions from the list.
Okay, let's do 3 and 7.
Alrighty, first question, number 3. What is the best piece of advice you've ever received, and why does it stick with you?
Well, a long time ago, a nurse who was helping me when I was taking my nursing exams, she told me that if it's the right thing to do, then there's a way to do it. You have to just figure out the way to do it. And so if you don't know how to do it, you just have to keep plugging along until you figure it out. And that's been true, I find, in every situation. You know, if it's the right thing to happen, then there has to be some way to make it happen.
That's great advice. I love that. That's going to stick with me too. Thank you. And then the last question, number 7. And this is a really interesting one, completely off topic, complete change of pace, but I really like it. If you could choose one superpower to have, and importantly, or any one skill to master, what would it be and why? So you don't have to choose just, flying, invisibility. You can choose that, but if you want to choose a skill to instantly master as well, you can throw that in there.
Well, I think it would be the ability to see what's in another person's mind so that I know what they're struggling with that they might not be telling me, what else is going on in their life or their household that I might be able to help them with that they're not telling me about.
That's fantastic. And a true healthcare provider's answer. My fiance is a nurse, and I've asked her this question before. She gives the exact same reasoning, so that checks
good.
out.
Smart lady.
Exactly. That checks out. Well, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. We want to once again thank our guest, Sharon Blackwell of Chesapeake Regional Healthcare, for joining us today. So thanks so much, Sharon.
Thank you.